look how tiny I get back here in comparison to the plant.
Oh, that's funny.
All right, well, I think we can get started. I'm sure people will continue to join as they roll in. You know, I know it's just 5 o'clock on a Thursday, but I'm really excited for today's discussion. Today's panel is going to be on one of the most important parts of breastfeeding, which is around how to maintain your milk supply. So this is especially topical, as I know things are opening up across California, which is where the three of us are, and people are thinking about going back to work and what's that going to look like. And so we are going to cover all stages of milk supply, from delivery to coming home to going back into the office. And so I'm very excited for this conversation. I've got 2 friends who just delivered babies in the last week, so I'm hoping I can learn a few tips and pointers to share with them. A quick reminder for all of the attendees, we are recording this session and we will share it out afterwards, as well as put it on YouTube. So if you have to leave, or just are busy breastfeeding and something happened, you can hop off and we'll still send you the follow-up. I know we got a bunch of questions for Katie in advance, so we'll try to answer as many of those as possible during the discussion, but you can also add any questions to our Q&A or into the chat if you want to DM me privately. I'm the Origin panelist. And a little bit kind of about Origin and just about the work that we do. We are on a mission to really empower women through physical therapy so that they can feel good in their bodies at every stage of life. So while we have a lot of patients that fall into sort of this pregnancy and postpartum, we also treat kind of the whole body, so general orthopedics, as well as things related to sexual health and into menopause. And it's really important to us that this care is accessible. So we are in network with most commercial insurance plans. We have clinics across San Francisco, Los Angeles, and offer virtual physical therapy in California, Texas, and New York. And with that, I will introduce today's panelists. So we have Katie Howser. She is a international board certified lactation consultant, and for the last 5 years has done in-home care to new families. She's treated over 2,000 families, which is crazy. So I'm sure if that's the 10,000 hours metaphor, she has well surpassed it. So she's our lactation expert. And then we also have Liz Miracle, who is the clinical director for Origin in San Francisco and also leads our clinical quality and talent. And with that, I will turn it over to Katie to kick us off. Oops, let's see.
Awesome, thank you so much. So we're gonna cover the very first moment that you meet your baby through sort of like heading back to work or weaning / trying to maintain supply to kind of get you through that, whatever goal that is, whether it's 6 months, 1 year, 2 years, it doesn't matter, just whatever that goal is for you. So again, please feel free to email in some questions or chat in some questions. So part of establishing a really good milk supply is starting off on the right foot. With that being said, it's not impossible to recover in any capacity, but if you are pregnant at this point and are able to kind of start off, have a few pointers to start off on the right foot, we find that the more milk you make in the first 3 days and kind of start to establish supply in those first 3 days, it actually indicates that you have more milk at the 3rd month. So really kind of getting off on that right foot is pretty important. So ideally you're going to breastfeed within the first hour of delivery. Obviously that's not always possible. With a vaginal delivery, baby comes right up to your chest and you're going to be able to bring them on. Think of skin to skin post-delivery as putting a baby at the table. A fun fact is the only organ in your whole entire body that uses more energy than your brain is a lactating breast. And when you have your baby by your breast, you're going to have these little bumps around your nipple. Those are called Montgomery glands, and they secrete a smell that smells like amniotic fluid. So when you're doing your skin to skin, it's like putting baby in Disneyland with popcorn. Like they know exactly what they need to do. So for instance, if you have a C-section or you are separated from baby in a short, immediately post-delivery, just restart that with skin to skin. And again, putting baby at the table so they're able to kind of work their way down and get the milk and kind of start stimulating that breast. This is a big one, feeding a minimum of 8 times in a 24-hour period. So starting, within the first 12 hours post-delivery because babies tend to be awake and then they tend to have a big sleep in the first day. But after that, we do want to get them feeding at least every 3 hours, start time to start time. You're going to offer both breasts with each feeding. There's no time limit on your feedings. Think of the first breast as appetizer and main course, and the second breast is dessert. So babies naturally are going to take more milk on one breast than the other. It's very common for one breast to make more milk than the other. Statistically, it's your right breast. We don't quite know why, but statistically it is one. And it's usually a 65-35 split. So again, a lot of people are going to have asymmetries, and you might have a breast already in the first few days of life that baby's preferring, and that's okay. You want to practice hand expressions. So Stanford actually has an incredible hand expression video, and I would recommend if you're still pregnant to actually start practicing post 38 weeks. That just kind of gets you used to touching the breast and manipulating it so that when baby does arrive, it's not such a foreign thing. And you can do it in the shower, and sometimes you'll see some colostrum to come out and sometimes you won't, but it's totally okay either way. Awesome. So days 2 to 5 post-delivery. So this is when your milk supply is really increasing in volume. So again, we're going to offer the breast every 3 hours. So that gives us a total of 8 feeds in the 24-hour period. Babies can always feed more frequently, but the longest we want them to go is every 3 hours because breast milk digests in 90 minutes. And so we're going to want babies to have a lot of access to a lot of food. We're going to do breast compressions. So that's a really fancy way of squeezing your breast, but it's not like wring it out like a washcloth. You're just going to come in and you're going to kind of gently squeeze the breast to kind of get that milk flowing. And then the biggest thing to monitor input is by baby's output. So in the first few days post-delivery, baby's going to be pooping out meconium. So we know that when baby's pooping meconium, you're making colostrum. Then as your milk starts to transition and you go to transitional milk where the breast takes on water and the milk supply starts to increase in volume, this is when your breast goes from feeling like the tip of your nose to your forehead. So it's sort of like a bad boob job. You're going to get transitional stool. So what you'll see is that stool starts to become a little bit looser compared to the super tarry meconium. And we know that you're making transitional milk when you're seeing transitional stool. And then by day 5, 6, and 7, you do want to start seeing mature stool. And for a breastfed baby, that looks like Dijon mustard. And there's going to be little curds in it that are going to essentially be milk curds. We want to observe if baby's mouth and lips are moist. So that is another thing that will tell us if baby's intaking milk. So if our body is not making this transition, then things to think about augmenting with are going to be pumping in those first few days, doing some hand expression. So again, if we're seeing output that's low from baby, then we're going to want to increase their input. Think of this, the first 5 days of life, baby has to pee and poop at least 1 time for every day. So day 1 is 1 pee, 1 poop. Day 2 is 2 pees, 2 poops. So if you think of a 24-hour cycle, if baby comes at 7 a.m. in the morning, 7 a.m. to 7 a.m. the next day, 0 to 24 hours, we want to see at least 1 pee and 1 poop. 24 to 48 hours, we want 2 pees and 2 poops. The reason that this is so important is because we are seeing milk supply increase in volume, and we want to make sure that it's increasing at the rate that baby needs it. So we will always, as healthcare providers, are going to be checking your baby's output regularly. Your infant's pediatrician is going to be asking, lactation consultants are going to be asking, the nurses are going to be asking if you're in the hospital. And so this is why we want to keep track of it in the very beginning. It's not something you need to do long-term, but it is something you want to keep track of. General guidelines to maintaining a milk supply. So feed or pump frequently. So I know that comes across as a little bit vague, but the idea is if you want to maintain your milk supply, prolactin is your milk making hormone, and that increases or peaks in the early morning. So 2, 3, 4 a.m. milk supply is going to be at its highest. And in the evening time, sort of the witching hour, it's going to be at its lowest. So that's when your prolactin troughs. So what we want to do is just make sure that we're removing milk regularly from the breast. So it's better to do it every 2 to 3 hours around the clock if we're trying to build up a supply, or versus pumping or breastfeeding for an hour 5 times a day. I would say this is always hard. Breastfeeding is definitely front loaded with work. And I think that's actually one of the hardest things. So when you're like kind of the most tired and learning how to do all this sore. So you're going to feed essentially every 2 to 4 hours around the clock for the first month or two. What will happen is baby's going to lose weight immediately post delivery, which is very common. We're going to need them to bring back up their weight by day 14. And then once they're at their birth weight, we can let the baby go on demand, which is a fancy way of saying instead of setting your clock to wake up your baby can wake up on their own. However, we still want to get at least 7 feedings in a 24-hour period when that happens to keep them growing at a good 1 ounce a day tick. You need to have 7 milk removals to maintain a milk supply. So that would be either a breastfeed or a pump 7 times. So roughly every 3 times during the day and every 3 hours during the day and every 4 hours at night. And if you're looking to build up your supply, you need to do 8 to 10 milk removals. A big component of making milk is having the calories to do it. So you burn 1,000 calories a day making milk. You need 300 to 500 extra calories every day to make milk. You want to aim for 3 meals and 3 snacks. You do want to snack in the middle of the night. Anytime milk is going out, you want to put some calories in. So snacking again is a really good idea. We want to look at high fat, high protein foods. So lots, protein bars, avocados, eggs, cheese. Cheese sticks is one of my go-tos. That's easy. Anything that's going to be really easy to eat with one hand. I know Liz Miracle recommends making an entire loaf of peanut butter and jellies, and that works.
Wow, good memory.
And then you want to drink 80 to 100 ounces of water each day. So, or 3 liters. The idea there is breast milk is 90% water. And if we don't have enough water, then we're not going to be able to make that milk. So high level takeaway here is going to be frequency of milk removals. So again, have it be at a more of a regular cadence rather than I'm gonna pump all day, or I'm gonna pump after every feeding during the day, and then I'm gonna sleep overnight. We can't hack nature. As babies get older, then when their speed starts stretching out, then definitely you'll start to see that the breast gets acclimated to those things. But in general, from the very beginning, you're not going to be able to get away with not pumping or breastfeeding during the night and maintain your milk supply.
And Katie, someone was wondering if that's 7 removals like per breast, like is that like each breast 7 removals, like 14 total, or like what is that math look
So
like?
in one session, we would assume their baby is getting, or the pump is using both breasts. Okay. So it would be both breasts.
Cool. And then are there any, I know you said like high fat, high protein foods are really great. Are there any foods that are like bad, or those are just like sort of like it's like calories are calories, but ideally high fat, high protein, or what does that look like?
Yeah, I mean, there are foods that are better for making milk, like oatmeal is really good. I would just say from a calorie standpoint, eating enough is the most important. Protein tends to give our bodies energy, and fat tends to give our bodies energy so that we can make the milk. However, peppermint and sage tend to be the two, like we don't want to eat a lot of peppermint or sage. They tend to actually decrease supply. But outside of that, I mean, you'd have to be drinking, 12 cups of peppermint tea a day for it to be a different, but don't worry if you eat a candy cane. It's not gonna.
I love peppermint ice cream. So that
So I mean, if you're struggling with milk supply, all of those little things can make a difference. But yeah, sage and peppermint tend to be the biggest things that we actually use in the weaning process. And anything that has pseudoephedrine, so Sudafed or anything pseudoephedrine based, anything that's going to dry up a runny nose is also going to dry up your milk supply.
Makes sense. And Liz, I know you wanted to touch on this.
Oh, this is me. Oh, fantastic. And also, spoiler alert for everybody, Katie was my lactation consultant, so that's how she knows about the bag of peanut butter sandwiches. I swear to God, that was my husband's cousin's recommendation. It was like the best thing I ever did. But let's talk about the bladder for a little bit, because I just hear Katie talking so much about the need to drink water. And a lot of times we'll have patients who are having issues in the early postpartum with urine leaking. And so they try to restrict their water because they don't want to leak urine. It's actually really not good for not only your milk supply, but also for your bladder. So as you start to restrict water, not only are you reducing your milk supply, but you're also telling your bladder that it doesn't need to have as much urine in it to feel full. So you might actually cause more symptoms of urinary urgency by not allowing your bladder to actually completely full. So I always tell people, if your lips are dry, you need to drink. So if you're feeling dehydrated, it's already too late. If you're not breastfeeding, I know Katie gave some recommendations in there, but if you're not breastfeeding, you need to do at least half of your weight in ounces a day. So that means if you're actually breastfeeding, you need to do a lot more than that in order to make that up. And then also another thing is that she's talking about getting up every night to feed the baby like every 3 hours. Try not to go pee every time you get up to go feed the baby. I know that there's sometimes like you just kind of like, oh, I just want to get back to sleep, so I'm just going to go pee and then I'm going to go back to sleep. But what you can do is to start a habit of needing to go to the bathroom every 3 hours. And then once the baby starts sleeping through the night, you're still needing to get up to go pee. So break yourself of that habit so that you're not then waking during a time where you don't need to be waking, and you're actually starting to wean those night feeds. And then another one is if you are having bladder urgency issues, it can be good to try to draw out the number of times that you're going to pee. And the number of times you're breastfeeding, 3 hours, is about the number of times you would go pee. So if you can kind of wait and hold out until it's the next time to pump or to feed, that's a good indicator of when it's time to actually go to the bathroom. And that can also help with urinary bladder leakage, because a lot of times when you're a busy mom, you just forget to go pee. So if you can remind yourself to pee when you're feeding during the day, that's a good reminder. And it's also a good reminder to tie to your Kegels. So I didn't put that in here, but try to do some pelvic floor squeezes when you're feeding your baby. Katie was also talking a lot about the high protein foods. So those, high protein bread with peanut butter and oatmeal can sometimes be constipating. So just make sure that you're taking the stool softeners that you're given in those early postpartum days. Elevate your feet on something like a squatty potty, maybe support the vagina with your hand. So just taking the hand over the front of the vagina when you go to have a bowel movement, or maybe even adding a little bit of magnesium citrate, like a natural calm, to drink at nighttime. A couple of common complaints that we get, like orthopedic type of concerns that people will have when they're feeding, is that they're doing a lot of sitting. And if you've had a tailbone injury with a vaginal birth, that can be really uncomfortable. And the go-to for most physicians for tailbone pain is just like a circular donut pillow. And that actually puts more pressure on the tailbone. So what you want is a cushion that has like a wedge cut out of the back of it so that the tailbone is free. And you would really ideally have the cushion would be a wedge as well. So that way you have support for your low back to kind of bring your low back forward. If you just type in on Amazon coccyx cutout wedge, you'll find what I'm talking about to help you with that comfort. Or you can take a boppy. So I don't know what your favorite breastfeeding pillow is nowadays, Katie. I feel like there's a lot of different ones out there, but I found the boppy totally not great for me because I have a really tall torso. And so I just couldn't get the baby to the breast with the boppy. So I just turned it around backwards and sat on it. So it works
I
really
use that
nicely
all the time.
Yeah.
I literally
really
am like, your bum hurts, let's sit on your boppy. That's the only thing it's good for.
It's the only thing. It's a really great cushion to sit on. I totally agree. And then if you are having discomfort, like in the wrist or the thumb here, we call that mommy thumb. So if you were to take your thumb inside your hand, wow, my hand looks really big next to that. It's like, that's not even my hand. If you take your thumb inside your hand like this, and then bend your wrist away, your fist away from your body, and you get pain in this little area of the wrist, you've got mommy's thumb. So you want to avoid that action and look for a thumb split. Typically, we recommend something firm and hard at night, and then something soft for when you're feeding your baby or during the day. And that comes a lot from trying to hold the breast in kind of like a hamburger position sometimes, or trying to express. So just try to protect the wrist there. You can do some gentle stretches like a prayer stretch or ice it. And then we can do some manual therapy and a couple of other stretches with you in physical therapy as well. And then clogged ducts. I don't know if you're going to go into that as well, but we talk about that in physical therapy too. So for people with recurrent clogged ducts, typically we'll do a light massage with usually what we use in clinic is a gua sha. It's a tool that's usually used in Chinese medicine for clearing the tissues. And we do it toward the breast. So we take that and go toward the breast. If you have an electric toothbrush at home, something that vibrates, There's lots of different tools out there now. They're like massaging tools for clogged ducts, but that's something that you can do, because oftentimes when that's happening, it may be hard to get in for a physical therapy appointment within the hour or two where you're really having a lot of discomfort. But that's something too that maybe you could pop onto a virtual consult with one of our PTs and we could help talk you through as well. I don't know if you have any comments on any of that stuff, Katie, or some of the stuff that you typically see that people are complaining about with discomfort when they're trying to feed.
Yeah, definitely, definitely the wrists, because I think there's a lot of carpal tunnel from the swelling and pregnancy. So that definitely translates into mommy thumb. I have been obsessed with the Levine massagers.
Yes.
They actually have ones now that vibrate and heat, which is really nice.
Oh, cool.
And I have found actually icing for 30 minutes for clogged ducts before after the breast has been drained, and then doing the massage is a really good way, with heat, is a really good way to reduce the inflammation, and massaging in smiley faces and rainbows. So going up into the lymph system and then back into the lymph system with the rainbows, so that we can kind of, again, get that traffic jam out of there, because there's going to be some swelling and edema around that clog.
Yeah,
so
and usually that's most of it. What's happening, right, is you're getting the swelling is what's actually causing the clogged duct, right?
Yeah,
so if you're too aggressive, you can make it worse.
Right. So actually, a lot of people, I had a mom do a Theragun, and I was like, let's not do that.
Oh, no.
So, but the idea is again, getting that movement back into the armpit and then allow the milk to go out towards the nipple. But Chinese. What is the Chinese? Yeah, they also do something like that in the Philippines as well. They have and it takes years for the practitioners to learn this amazing technique for massage post-delivery, and they really get the breasts rocking and rolling.
That's where I got the idea behind the moving toward the nipples. So there's an actual research study on that, but they won't give you the full technique. You actually have to do that whole program, and you can't find any videos because in their culture you can't do like videos of the breast. So all the videos have like a sheet of the woman's covered with a sheet and the practitioners under the sheet. I'm like, that's not helpful at all.
Yeah, that's so
funny. I did my best to try to like figure out what they were doing. And the only I have on this slide that I thought about after the fact, Allison, was that Katie was touching on hormones earlier and prolactin. And when your prolactin is high, your estrogen is low. So a lot of people will talk about discomfort with penetrative intercourse because of the low estrogen levels. And so a lot of times with that, you might see a little bit of irritation or redness around the opening of the vestibule, the opening of the vagina, and it just might feel dry or raw. So typically we'll recommend like a water-based lubricant, like Slippery Stuff, or maybe a silicone one like Uberlube. But typically the best way, that the most surefire way to take care of something like that is going to be a topical estrogen to the opening of the vestibule. But that would be something you would need to have a conversation with your physician about to get a prescription for. It's not something you can get over the counter.
Well, and Katie, we had another question when we were talking about, drinking a lot of water, not doing the peppermint tea excessively. Does caffeine also contribute in that way?
No, you can have 2 to 3 cups of coffee a day, no problem. Alcohol, the same. You have to be blackout drunk to have enough alcohol in your milk to buzz your baby. So really the one thing with alcohol, as far as reducing supply, is that it can dehydrate you. So if you do partake in a glass of wine every night, just make sure that you're also drinking water. Same with caffeine, just as as a laxative. So therefore, it can be a dehydrant.
Very helpful.
So heading back to work. So a few things that I found as far as that is makes kind of the transition back to work a little bit easier is creating a schedule before you kind of get there. A lot of people will email and I'll do a 30-minute call and kind of be like, what time do you want to leave? What time do you want to come home? And we can kind of create a schedule that way. One thing that I try to incorporate is feeding right before you start your workday. So if we can get the breast drained and the baby fed right before you start, you're going to have that longest time until something needs to come out of the breast. So, trying to feed again right before you leave, or right before you jump on Zoom or something like that can be really good. And then you need to pump every 2.5 to 3 hours during your workday. but it doesn't have to match your baby's schedule. So sometimes, especially when back in the day with commuting, but is going to be coming back here in the Bay Area, I have a lot of families that are coming either from Marin or San Francisco down to the South Bay. And so they may be in the car for 30, 40, 50 minutes. So they may be pumping then. And so that might be, that's a really easy way to get that extra pumping session in. You can do it on the move. And one thing you want to do is not necessarily match your baby's schedule. So if you find that you're meeting heavy in the morning or meeting heavy, you always have to go to a lunch meeting or things like that, you can kind of make your schedule match what works for you. It's better to pump closer together than further apart. So if you know that you always have a lunch meeting, maybe you pump 2 hours apart in the morning and then have a 4-hour break in the middle of the day. You want to massage the breasts while pumping. If you do a 10-minute pumping session, you want to massage about 30% of the time. So those compressions is where that mommy thumb can kind of come in, because you're going to be squeezing the breast in all the directions. But Stanford did a study and found that moms could actually yield a decent amount more milk when they use their hands. And also it will help get all the fat off of the milk ducts, at the same time kind of helping protect that supply from clogged ducts and mastitis, because babies really are the best pumps. And when we're away from them, we just want to make sure that we're getting good stimulation along with good drainage. You want to use a double electric breast pump. So that would be where you are pumping both sides at the same time. You're going to have a higher oxytocin release when you're pumping both sides at the same time, which therefore means that you're going to have more milk. So that's a really good, easy way to allow your body to be stimulated. A lot of the tech companies here in the Bay Area have hospital grade pumps in their mothers' rooms, which is really great. But the Spectra S1 is definitely my go-to as far as personal pumps. They're really, really good. They're good for 1,500 hours of pumping, which is an incredible amount. I prefer that over the Medela. I find that you can just kind of customize it to what you need. But there are a lot of people that do like the Medela pump and style as well, which is another one that insurance companies can offer. But outside of that, you're looking to remove milk roughly 3 times while you're at work. If you find that you have a high capacity means that the breast can store a lot of milk and kind of sit for a little bit longer, then you can get away with 2 pumps. It's just that you want to make sure that you're matching what your baby's taking when you guys are separated. So bottle feeding a breastfed baby, I think this is actually where the wheels fall off the bus the most with regards to people heading back to work. So your baby only needs 1 to 1.5 ounces per hour that you are away. So the average amount that you can leave a baby with is about 12 to 15 ounces in that, again, full 8 to 9 hour day. So that would be roughly 3 4-ounce bottles or 2 6-ounce bottles, whatever your baby's needing. But when your caregivers keeps asking for more and more milk, that usually is a sign that they're using the milk to calm baby rather than not, and they're misreading the hunger cues. It should take 3 to 5 minutes for baby to complete 1 ounce. So if they're kind of logging in on the daycare app or whatever, that they're taking the bottle within 5 minutes and they need more and more milk, that just means that the baby's brain and belly didn't have enough time to have a conversation, that they were full. So it does take a total of 15 to 20 minutes for, again, that conversation to happen. So if your baby's a really quick eater, maybe you need to go down on your nipple size. So when you bring your milk to your childcare provider, that the flow is slower. The other thing is, it's hard, especially because when you have formula, right, it's just endless. You can go and make more formula. So it doesn't matter if they eat 4 or 8 ounces, but the breast is not. And the reason that it's so important to keep baby contented with, again, the 3 to 5 ounces per session is because that's what an average breast is making. And if we're filling the baby's tummy to 6 or 7 or 8 or 9 ounces and you're not able to pump that, then the times that you are with baby, they're not going to find as much satisfaction or satiation with the breast. And that's going to lead to premature weaning. So there on kellymom.com, there's an incredible paced bottle feeding technique handout which I know sounds funny, but sometimes it's just people need to, be brought to light about, okay, this is what we need to do, because mom's goal is to breastfeed, and it's not necessarily everybody's goal, but if it is your goal to breastfeed, an entire year, or, however long that is, we do need to protect the bottle through through the bottle feeding when baby is not away from you, when baby is away from you and not with you. So if you notice lower milk supply, do we have any questions before this?
We did have a question that was just around, we had two actually. One was around, if you said you have to be blackout drunk to buzz your baby.
Yes.
Do you have any general guidelines around that? We can start with that one.
So honestly, it would be a glass or two of wine is no big deal. The milk screen things that people get are just like a joke. The amount of alcohol that gets into your breast milk is the same as your blood alcohol. So if you feel like you can drive, which I believe is 2 glasses of wine, then for a 0.08, then you can handle your baby, then you can breastfeed them. Because as your breast sits, the breast will essentially reduce the amount of alcohol in it. But then if your baby eats the milk, when you say you're 0.08, that milk is digested by baby and it never reaches their blood-brain barrier.
Got it. Super helpful. And then the second question was, is your higher producing breast always the same with baby number 2? Her left breast was pretty useless last time, and she's curious what will happen again this time. And also wanted to get your take on the LV pump.
Okay. Of course.
That's the one that like sits in your bra, right?
Yeah, totally.
Yeah.
So statistically, we are going to have one breast that makes more, and it is going to be the right. And you do grow breast tissue with every subsequent pregnancy. So you are going, no matter what, to have more milk with this pregnancy, with this baby, than you did with your first and your third and your fourth. It will pretty much always be one side makes more than the other, and it will pretty much always be the same breast. If you have a baby that has a preference very early on and they trigger the breast that was maybe the lower producer with your first pregnancy, but that was baby's favorite breast the second time around, you might get a closer match. But I would recommend in that case to start using a Haka, with a suction pump, and maybe pump after feeds, if it was that different, because that can sometimes just be a little bit uncomfortable, because if one side's filling up with a ton and the other side isn't. And then the LV, is that the last one? The LV.
Yeah, that's the last one.
Okay, so the LV and the Willow.
Spectra last time, so I was curious, like, your thoughts on the difference.
Yeah, so the LV, the LV and the Willow are, I'm 33, so when I went to high school in the 2000s, it is like the Nokia, and we're looking for the iPhone. They're just not that strong. So it is very much an okay for an every once in a while pump, but I use the LV to the likeness of, if you aren't able to pump with your Spectra and you would not be able to pump and you have the LV, then I would use it. But you cannot use it as a replacement pump. It will not build up a milk supply, and it will absolutely not maintain a milk supply. It cannot drain a breast. And that's purely because the motor is just not big enough.
I'm just laughing because they also make a pelvic floor strengthening device that is not necessarily great postpartum either. So it's like way too tiny and just gets lost in the vagina. So
everything of them is underperforming.
God. Yeah, that was it for the questions down. We can
okay, cool.
There's more later, but I think this is
okay.
a lot of them are around maintaining supply and undersupply and weaning. So I think that's super, super relevant.
Awesome. So if you do notice a lower milk supply, again, kind of reiterating, drink a lot of water, eat a snack every time you pump. This is imperative, especially when you're back at work and you're separated from baby. And it's just like strap the pump on and kind of do as much as you can. You just have to throw snacks in your bag, snacks in your desk, eat. If supply hasn't completely come in, or you've noticed a dip in it, before you head back to work, you want to pump for 10 minutes after each breastfeeding session. That essentially continues to tell the breast, hey, you're not making enough. Let's boost it up for that 10-minute session. Change your ductal valve or membranes on your pump. So that's the little kind of white silicone piece that's on the bottom of your flange that the milk drips through. Those actually expire pretty quickly, and they need to be changed roughly every 4 to 6 weeks. So you kind of want to buy a bunch of those because that's what creates the reverse suction on your pump And so if that's not working perfectly, you're going to see lower output. This is the hard one. So say you're back at work with a 4 or 5 month old and your baby's sleeping through the night. How lovely. But you're noticing lower supply throughout the day. Again, the nature has not programmed us quite yet to only make milk for 12 hours and let our babies sleep 12 hours. So you want to either pump before you go to bed. If your baby's sleeping longer than 6 or 7 hours, you're going to want to get up and pump in the middle of the night, even if it's just for 10 minutes. That is the absolute best way to either build up a supply, or if you're pumping a little bit less when you're at work, the best way to get that little extra milk for baby. Think about some herbal support. You can obviously talk to your lactation consultants or healthcare provider, but examples of herbs that I really liked: moringa, spelled wrong, M-O-R-I-N-G-A. Moringa increases your prolactin. Prolactin is your milk making hormone. Goat's root is really good for tissue development. So in the beginning, in the first month or two, goat's root can be really nice. Fenugreek increases secretions to sweat glands, and mammary glands are sweat glands. The trick with fenugreek, though, is you have to take a large dose of it, and sometimes it can cause GI pain in both mom or baby. So just be really mindful if baby starts to get really gassy. And then shatavari works really well. And we learned about shatavari from India, and it helps balance your body, and it tends to work really well in a lactating breast as far as allowing prolactin to surge.
Does Mrs. Patel still make those bars?
Yes. Yeah. So the bars,
so good.
So the bars are a little bit, you have to, the encapsulated tends to be a little bit more potent. And the cookies and the bars and things like that, they're good for calories, but they're not
like a treat.
Yeah, exactly. So lactation cookies are great, but if you really are truly having lower supply, you have to drink 12 cups a day of the lactation tea. So you're going to want to think of something encapsulated to it's just more realistic way to kind of get supply up.
Got it. Yeah, there was a question around giving baby milk that was pumped in the AM versus like the evening. Does that matter at all?
No. So milk does change throughout the day. There is melatonin and serotonin in milk, but it's a very small amount. And really it's more of when baby's at the breast. So don't think that the milk you gave your baby from 7 a.m. is going to wire them if you give it to them at 7 p.m.
Awesome.
And then you do want to reach out to a lactation consultant. So lower supply is definitely what we call an acute issue. So it's something wrong either with you on your breast tissue or your baby's latch, or how the two of you are working together. Because in most cases, most women are able to create enough milk to feed their babies. But what we do have to do is double check that their latch is nice and deep, they're able to extract milk. We want to establish that you had breast changes in pregnancy. And again, all of this stuff will kind of come to light in the very first few days or that first week if we're not seeing our milk supply increase. And if we don't see our milk supply increase, we're going to not get the output that we need for baby. So all of these things are kind of tied together, and you'll get a pretty clear picture very quickly. High blood pressure, postpartum preeclampsia, really long, hard labors. Sometimes it will take your milk a little bit longer to come in, but that doesn't necessarily mean it won't come in. But at that point, you do want to work with somebody that knows about milk production to get you on a plan specifically for what you and your baby need.
Awesome. I think that was it. I think we still have a couple of questions. So if you have any questions, feel free to put it in the chat or in the Q&A. I think there were a couple that were submitted in advance that maybe would just be helpful to touch on, Katie, which
okay.
One was around like baby growth spurts. Or is there
Yes.
anything you need to do around milk supply there to really try to keep it up?
Yeah. So you want to continue feeding really frequently in growth spurts. So what will happen with baby is it's like your baby's putting their order in of what they need. So kind of keeping them frequently at the breast, kind of following their cue. This is not the day to like schedule people coming over. If you're noticing that there is a growth spurt, just feed super frequently, stay super hydrated, because again, that's your baby's natural way of letting them know, the breast know what they need.
Got it. And what about, there were a couple questions about weaning and or like switching to formula. So when is it okay to switch to formula? What is that, like how should you think about that?
Yeah, I mean, anytime you can go to formula. We're lucky that we have formula that allows us to, get a baby's brain to grow and nourish them. I would say we know that breast milk is good for babies. Babies don't need it's not an all or nothing game. They don't need a huge amount of breast milk to get immunities. So a lot of people will combo feed if something, things happen, right? Sometimes we have to sleep a little bit longer at night and we have to replace the feeding with some formula, or we're separated from baby, or milk supply is taking longer to come in. So at that point, you're going to need to introduce some formula. We don't necessarily always have to use formula. There's a lot of people that use mom-to-mom sharing, milk donors. I know in the hospital in San Francisco, we have milk bank milk. So if your baby's in the NICU here, they can have human milk that was donated and pasteurized from other moms. So we have lots of options. As far as like any amount of breast milk is good for any baby. So as long as breastfeeding is mutually beneficial, you should stick with it. When it's no longer mutually beneficial is when you need to start thinking about augmenting it either with some formula or some pumping or starting the weaning process. It takes 40 days for the breast after your last milk removal for the breast to completely dry. So definitely if you feel like things are getting really overwhelming and things like that, then you want to start ramping down. And again, you can just slowly do that. So if you're at 6 milk removals a day, every few days, 4 or 5 days, bring it down to 3, 2, and then 1. And at that point, you can drink as much peppermint tea as you want and take Sudafed.
We had a question on how to avoid or correct one boob getting bigger.
Nothing. Get a sock. That's
an issue.
Yeah, that's my suggestion. It's some people will send like, oh my gosh, I pumped this extra breast for 40 minutes a day and it's extra and it's still uneven. It's just one of those things. One hand is bigger than the other, one foot is bigger than the other. We're all naturally stronger or bigger on one side.
I called it my power boob. My left boob was my power boob.
Yeah, totally.
Twice the size.
Strong side.
So again, you just kind of lean in, don't wear a bikini. I mean,
yeah, definitely. We had a question about someone who had a C-section last time and she's trying to do a VBAC this time.
Great.
Do you have any other tips for the early days after giving birth? Her milk didn't come in for 5 to 6 days last time. So she was hand expressing colostrum. So should she pump
awesome.
cadence during that first week too, or how should she think about that?
Yeah. So, either way, whether it's a C-section or a VBAC, your milk will come in a little bit quicker because it's your second baby and your breast has memory, so it will remember what to do. I would say just because it can be a little bit traumatic with the first, that your milk doesn't come in and you have a little bit more knowledge based on your second, I usually have moms start to pump within the first 12 hours post-delivery, just 10, 15 minutes after every session for 1, 2, or 3 days until that milk supply comes in, just to give it a little extra kickstart. Because again, I know it can be a little bit traumatic if you know that has happened in the past and people want to prepare. But hand expression, and then the Medela Symphony actually has, which is in most hospitals, has a initiates mode that they created that is like a start-stop mode, and it does a 15 minutes, and it's supposed to mimic the first few days post-delivery, and you use that up until you make 20 milliliters of colostrum, and it just, again, it's supposed to initiate that milk supply, so it starts and stops, and then the pump turns off after 15 minutes. So it's a really great thing that Medela has out there. I really, really, really think it works.
Can I ask you a question related to that, Katie?
Yes.
What about hand expressing prior to birth? Like, how early could you start that?
Oh, antenatal hand expression. That is really hot topic. The OBs hate it because they think it schedules preterm labor. If you have gestational diabetes or things like that, I usually say post 37 weeks, because baby's considered full term at that point. But that would definitely have to be guided by a lactation consultant. But antenatal hand expression is definitely something that I have clients do that have gestational diabetes, because babies tend to be a little bit bigger and their blood sugar goes down really quickly. And then everyone wants to give them formula immediately post delivery. And if you have this this colostrum, they're able to augment with that as well. But again, here, I don't know where everyone is from, but we have the milk donor program at our hospitals. So you can always, and I would ask everyone at every hospital, just on your hospital tour with your OB, do you have access to this if breastfeeding is something that you're really trying to get going? Because babies tend to overeat with the formula because it has a little stomach stretchers and things like that. So the donor milk is nice.
I'm asking more questions. Sorry. I have a lot of patients who their physicians for one reason or another are trying to schedule an induction early for them. So maybe like a 39-week induction, and they would really prefer to go into natural labor.
Yes.
So I have kind of a handful of things that I say, go eat some dates, see an acupuncturist. Is there something else that they could add? Like, could they add hand expression in at week 37 with a lactation consultant as a method to try to bring labor on so that they don't have to do the Pitocin induction at 39 weeks?
And I would even encourage actually pulling out the Spectra or a pump at 39 weeks and getting on the pump.
Because if they could they do it just that, those few days before the doctor is talking about inducing them, to maybe try to avoid that.
Yeah, nipple stimulation tends to be really good to induce labor, and it works for a lot of women. Sex aggravates the cervix. Sperm aggravates the
sperm. Yeah, sperm releases the hormones that help it. Yeah, so sex is on the list too. But I like to make the list as long as possible.
Nipple stimulation is good, and I would beg the question that hand expression is not as efficient as getting on the pump.
Cool. All right. Thank you, Katie.
Awesome. Another question was around, does sleeping on your stomach hinder milk production at all, or can it?
Oh, I know the stomach sleeper is just. No, you're good. I mean, I would just make sure that you're not in one position all night, but if you boobs are letting you sleep on your stomach, go for it.
And then I think if there's any more from the panelists, feel free to write in. But another one we had was just how to know if your baby's weaning versus needing to pump to maintain supply. Like, especially, I think this person was, the baby was 11 months. So I guess sort of how do you determine that?
Yeah, so in that case, I would say, especially for an 11-month-old, I would just start augmenting in with more solid foods and cow's milk, or some other milk, almond milk, whatever they're going to be having milk-wise, and just keep offering the breast. And again, if there's turning away and they're not interested, then you have an idea. But if there's still interest and they say they're interested 2 or 3 or 4 times a day, then you would want to continue pumping if you're away from baby around those same periods, but it's never like an 8 times a day pump. And I know someone had asked about maintaining supply from that last month. So it's less about maintaining, and it's kind of just like the ship is sailing to the night, and just, again, augment in with a little bit more solid foods, and keep it really calm and relaxed. But at the same time, if you are away from baby and they are on, like, say 5 or 6 feeds a day, then you are going to want to pump around those same times.
Awesome. I think that is all the questions we have. I'll do one last call out to any of the attendees for any last questions, but otherwise, Katie, this was so helpful. I learned a lot, which is always exciting, especially with all my new mom friends, but really appreciate this. And if Katie, if they wanted to reach out to you, what's the best way to get in touch with you?
Yeah, they can go to my website, katiehowser.com, and I have a contact page. And there's also, oh my gosh, ILCA, which is the International Lactation Consultant Association. And that they have a list of lactation consultants. So lactation consultants in your area, you can type in your zip code, and that works really well. But I like I said, I'm located in the Bay Area of San Francisco.
Wonderful. And like I said,